Chio, welcome to Cherokee Now. Today we have Lucretia Dawkins with us. Lucretia is the Patient Registration Manager with Cherokee Indian Hospital. Lucretia, thanks for joining us on the show today.
Thank you for having me.
Yeah, no problem. Give us a little information about patient registration at the hospital right now. What all do we need to know?
So the reason I wanted to come in was kind of talk about eligibility because it is complex. You know, it's kind of always been the same, but, you know, people don't realize what they need to know until, you know, they have referrals or medications that they're needing to pick up.
And you get
sometimes
a ton
we can
of
be a
questions.
hindrance.
Yeah, and you get a ton of questions, I'm sure, and issues out there in the public that we want to just give a chance to clear up and give some help with how to get there. So what do we need to know?
So today I'll be addressing mainly eligibility for enrolled members.
Okay.
So first of all, we have a CHISDA, or it's also called the PERCTA, which is the Contract Health Service Delivery Area.
Okay.
And this is set forth by the federal government that states that any county that has tribal land in it will be the service area for that facility. So our counties are Haywood, Graham, Jackson, Swain, and Cherokee.
Okay.
So in order to qualify for referrals, a person would have to live within those counties.
Okay, great. What's the referral process like?
So if a person needs services beyond what we can provide at the hospital, if they're CHS eligible, they'll have a referral entered in to an outside facility. And then, you know, if they don't have insurance, you know, the hospital will kind of negotiate costs with those facilities to cover for those patients.
Okay, excellent. So I know we had discussed a little bit before we got started here about like the referral appointments and screenings and such. Tell me a little bit about that information.
So a person has to provide two proofs, North Carolina driver's license or a state ID or two proofs, and the proofs have to have a physical address on them, and it's non-forwarding type of mail, like a power bill, a water bill, a bank statement, anything that's non-forwarding. Somebody can bring in to provide their proof of residence.
Gotcha. Looking through my notes there. What other questions are you guys getting out there?
I think the biggest thing that we get is when people get collection notices.
Oh, okay.
So somebody goes out to an outside facility, you know, they'll take their referral, or one of our staff members at the hospital will fax it over, but there's constant turnover in these outside places, and Indian Health isn't probably one of their top priorities of educating the billing process on. Or if they decide to contract with an outside company to do their billing, you know, somebody might see an office in Silva, but the bills are coming from Pennsylvania or something like that.
So walk me through a process of a referral. How will this work if this needs to happen, and all the way through to the point where I'm getting a bill from a provider and bringing it back to you? What's the first steps that I would do?
Okay, so say you wanted to address, you know, some skin issues or something. You want to go to a dermatologist. You would come in and see your primary care provider. You know, if they felt like they couldn't do anything for you in-house, then they would try to refer you to a dermatologist. Okay. And then you would go to the dermatologist. Let me take a step back. So the referral would be entered and it would be reviewed. Okay. And so every day I have people that scrub the referrals to make sure, you know, we have Indian cards on file, we have proof of residence on file that somebody qualifies for referral. And then if somebody doesn't have a resource like Medicare, Medicaid, or a third-party insurance, they have to be screened by RCA, which is located at the hospital in Onalanisky, because we want to be good stewards of our funds. And so if we can get somebody signed up for Medicaid, you know, that helps us stretch our contract health service dollars further. So then, you know, once your chart's good, you know, you've got a resource or you've been screened, then you'll get an appointment scheduled. You'll go to that outside appointment, take your referral with you. We have staff that fax as well. You know, make sure that you let them know that Cherokee will be your secondary payer or your primary payer, you know, if you don't have insurance.
If you don't have the other insurance.
Yeah, if you don't have insurance. And then from there, you know, it's kind of, we've been working with Duke Life Point, which owns Harris and Swain and Haywood, you know, trying to get, you know, a better process. But you still could potentially get a bill. So if you get a bill, that means Cherokee didn't receive the bill, and so there's nothing there to flag them that it needs to be paid without that bill.
Okay.
So
don't just throw the bill away.
Yeah,
at this
don't
point.
throw it away. Bring it in. That way somebody can research it and get it paid for.
Okay.
And if you get a collections notice, don't pay that either. Bring that in. We have people there that can help get that taken
Clear
off
that
your
out.
credit. Yeah. But once you pay it, there's nothing else we can do. You've kind of assumed that.
Okay, so if I get a bill or a collection notice and I pay it, that's on me then.
Yeah.
The process to do it is to get it to the hospital,
Yeah.
to your crew there,
Yeah.
and get that paid.
And people can bring it to the primary care desk right when you come in the front door that says primary care. Either desk can take the bill, and we'll
Okay.
make sure it gets to contract health.
Now, you had mentioned, to take it back a couple of steps, I had a dermatology issue. What if I know you prioritize the referrals, is that correct? Mm-hmm. So tell me a little bit about how you prioritize the referrals and what typically those are labeled as, I guess.
So the way we send them out is there's P1s, which means it's urgent and emergent, and then we have P3s, which is medically necessary, but it's not, an urgent issue that has to be taken care of, today or tomorrow. It can wait a little while.
So would my dermatology appointment typically, would it be considered a P3?
Typically,
Okay.
and it depends. We have a managed care that meets every Tuesday,
Okay.
and they review all these referrals, and they'll kind of categorize them as 1s and 3s. They have a set list of what is 1s and 3s, but they still have to meet and kind of go over it and see what if it's necessary to be moved forward.
Would a P1 have priority per se over a P3? You said that was kind of emergent.
Yeah.
Okay.
Yeah, those get sent out first, and then P3s are kind of held. Make sure your chart's good. Make sure you have applied for resources, and then you'll be sent out for that.
Absolutely. Now the P3s, a lot of them, are they? How are they? Are they funded through tribal dollars, or were we discussing that?
And so that's why only enrolled members of the Eastern Band qualify for P3 referrals, because it is funded with tribal gaming dollars.
And that was part of I guess some of the criticism or some of the complaints in the past has been about not funding other folks, I guess, for P3 referrals. Mm-hmm. But the understanding is that money is earmarked only for enrolled members of the Eastern Band, and that's the reason we don't refer other folks out.
Yeah.
Okay. Do you have any other notes or any other questions or concerns that you typically get from the public?
I think another thing too is that if anybody updates their address or phone number, to make sure to come by and let us know. We have a lot of people, we have, a lot of phones,
Right.
It seems like every per cap, people upgrade to better phones, and a lot of phone numbers change.
You've got to be able to stay in touch
Yeah,
with
just
folks.
make sure that you let us know. That way your care team can get a hold of you,
Right.
if there's anything, or if they want to get a hold of you for, just annual exams.
And if folks need to do that, can they call in and do that, or do they need to come in person and update their record?
They can call in,
Okay.
and we'll just verify over the phone, who they are.
And the
then
number
we
there
can
is
update.
9163 to the hospital,
Yeah.
correct? Do you have any other? You had a line to your referral program. Is that what it was we discussed earlier?
Yeah. So for referrals, if you have an appointment that you're trying to inquire about, you can call extension 6218.
Okay.
And then if you have any patient registration questions, you can call 6603.
6603.
Yeah.
Okay, great. Well, I think we've covered a few items here that are some hot topics that we need to get information. We'll continue to put that out there. Anytime that you or your program have needs that you need the public to see or hear, plan to come on the show and let's talk to them about those.
Definitely.
And I know there's a lot. You have in your world a whole lot of things that you're going through, and the public have a lot of needs out there that we need to answer their questions with. So anytime you have anything, please come on and join us, and we'll make this a regular thing if we need to.
All right. Thank you.
Well, that'll be it for today. If you're listening at home and would like to comment on the show or ask any questions regarding what we've discussed today, please comment on our EBCI Cherokee Now Facebook page at facebook.com/Cherokee Now. We look forward to seeing you soon. Data Dog